that we are trying to unlock your brains, the medico's mind, right? And hopefully you all are during the summer break, right? While there are other people who are relaxing, you all have the spirit to learn. So hopefully this webinar is of use to all of you here. First of all, I would like to extend a heartfelt gratitude to our collaborative organization who is working with us throughout this webinar, Dandy TMA, and I would like and appreciate their continued support and partnership during this webinar throughout. So let's start things off with a couple of facts that I would like to highlight to you all, right? More than 75% of medical students and residents today are experiencing psychiatric issues in the US. So they have to be on medications constantly. 36% of people are experiencing insomnia. 63% of these people, or some people, are overwhelmed with distress. And 25% of people are experiencing severe cases of stress. The burnout rates are massive, ranging between 44% and 71%. And last but not least, around 38% of people are battling from depression. My dear audience, these numbers might look massive, and it definitely is. Because from someone who has been surrounded by people who have gone through these issues, I'm sure that even you all might know of people or are personally experiencing some of these issues. But hopefully, this webinar will give you better understanding and tips and tricks to overcome these conditions. So let's move on. By we have, I would like to take a moment to introduce our senators from Dandy TSMU, Iman, and the senators of Dandy TMA, the outgoing senator Tony and the incoming senator Milana. And we have our senator Iman from Dandy TSMU who would like to share a few words. The stage is yours, Iman.
Thank you for that introduction, Shabir. So, hello everyone. I'm Iman Imam, and I'm a medical student in TSMU final year. And first of all, I'd like to thank everyone for joining us today. And just to know, I'm extremely proud of everyone who joined either in hopes of bettering themselves or even better understanding themselves. And I extend my thanks to the amazing doctors who took the time of their day to share their knowledge with us, and to the international dandies who joined us as well. And the goal of this webinar is to be lighthearted and more conversational, not a lecture type of webinar. So if anyone here loves podcasts, this is more of a podcast style where we will be listening to a discussion, a back and forth conversation with doctors, and it's relaxed. So things that we relate to. So I'm not going to keep it long. So I hope everyone enjoys today, and thank you for joining as well. Thank you, Shabir.
Thank you very much, Iman, for your amazing words, right? Let's start things off. Hopefully, whatever I speak is not boring, right? So, we'll start by highlighting why we did this webinar. What is the aim, right? One of the key fundamentals that we hope to achieve is to support each other, the medical students in their professional journey, right? Provide a deeper understanding of their personal experiences, offer expert insights on managing stress and preventing things like burnout, right? Enhancing the mental well-being is one of our also crucial topics that we would like to cover today. Support effective navigation of demanding careers in the future. Last but not least, preparing for the upcoming semester that will be commencing in a few months. So it's good that y'all are here to re-energize yourself, right? Because as medical students, we are constantly learning. We have the pressure surrounding us to be good, to excel in our curriculum, right? And we also need to look after our physical and mental status. Only then it will enable us to move to the next level, right? So don't you worry. Today's webinar, we have some exciting and thrilling guests and professionals who will be here to help all of you have a better understanding of yourself and a proper guidance to where you have to take your future steps, right? So today, if you have ever felt in the past, I'm certain that some of you must have, right? Where you must have felt lonely, right? But we would like to focus the script on y'all, right? Where you guys will have the opportunity to raise questions and thought-provoking insights from the guests will hopefully help you all have a better understanding, right? Enough yapping, and I would like to move on by introducing the guests we have today. First of all, I would like to congratulate or thank the guests for joining us today. It is definitely my pleasure and both of our organizations' pleasure to host you all. Right. Firstly, we have Dr. Afra, a licensed clinical psychologist, student counselor at LUMS, with counseling therapist experiences, with various other interesting skills throughout, all the way from Pakistan. Next up, we have Dr. Alalade, yet again an MBBS and MPH, Master in Public Health, consultant psychiatrist, and specialty in adolescent mental health. We are deeply honored to have both of you here today. Next up, we have Dr. Khatia Khatiashvili, an MD from our own TMA, MS in Psychology, Masters in Public Health from Emory University, Atlanta, USA. Currently working as an associate professor in DMA and public health specialist. And last but not least, we have Mr. Abhishek, licensed clinical psychologist, all the way from Kolkata, India, academician, uh, health and social science scientist. Yet again, I would like to take this opportunity to uh, welcome, first of all of our guests and speakers to this webinar. Thank you very much for you all to take your time to be with us. And we are definitely excited and looking forward to hearing all of your valuable and interesting insights. Right? I would like to reiterate that at the end of the webinar, all the attendees will be getting a electronic certificate that after you fill the feedback form that we right. So before further ado, I would like to call my colleague Athroba to lead the next segment. Over to you. The podium is yours.
Hello, everyone. My name is Athruba. I'm a fifth-year medical student at TSMU, and I'm also the head of presenters and speaker of Dandy TSMU as well. So it's very nice to meeting all of you, and I'm very happy that a lot of you are here for your betterment of your mental health and your care for yourself. I would like to start off this panel discussion with Dr. Afra. Can you please introduce yourself, doctor? Thank you for coming on this webinar.
Hello, everyone. Thank you, Atruba, for the wonderful introduction and for the wonderful welcome. My name is Afrah Arshad, and I'm a clinical and counseling psychologist. I'm licensed clinical psychologist from uh, American Association of Psychology. Well, I'm thankful to PsychiaTRICKS for arranging such an important and insightful event, since medical students, they are suffering a lot because of the nature of the field. And unfortunately, due to the lack of the mental health resources and the stigma that is attached with mental health, the students are not seeking help. The mental health of medical students is a critical yet often overlooked aspect of their overall well-being. There's intense academic pressure attached to it. There's an intense demanding clinical rotations, and there's high expectations that is placed on all the medical students. which creates an extreme stressful environment for them to study, to work, to enhance their skills. And unfortunately, it also impacts their mental health. These issues, they are very common among medical students, and the most prevalent one is depression, anxiety, and stress. Now, I would like to shed some light on the depression, even though it's something that we all are familiar with it. We all have already heard the word depression, but what are we basically doing to, deal with it? So I'm thankful to the organizers for arranging this event, for arranging this webinar, because I'm sure that we will not only be discussing the challenges, but we will also be, talking about the coping strategies that are deal with that are attached with those challenges. Now, there's a lot of research that has been conducted, and it showed that depression among medical students, it's ranged from 30 to 50% of the students. So out of all the students, at least 50% of medical students, they are somehow experiencing the symptoms of depression. They are somehow diagnosed with depression disorder. Now, the reason behind is the academic pressure that I've already discussed and the expectations. Now, if I say expectations, it's just not limited to the societal expectations or family expectations or expectations from their, particular parent. Maybe it's a father's dream that they want their daughters or sons to be a doctor, or mother's dream. But when I say expectations, it's also about your self expectations. We have raised those expectations for ourselves in such an unrealistic manner that if we do not compete, or if we do not succeed in a particular exam or in a particular quiz, we start punishing ourselves. We start feeling guilty for ourselves. We start feeling ashamed of ourselves. So that's also one of the major cause of having such mental health challenges. That is the expectations that you're having from your own self. Now, there's something that I also want to share. I don't know if it's in common in your community, but here in Pakistan, it is said that a normal human being have 24 hours in a day, but a medical student, they have 30 hours in a day. Why? Because they need 6 hours extra to complete their study in a day. That's how much workload they are having. And the institutions and the communities, they are not doing anything to lower down the load. Neither they are doing anything to challenge the mental health problems that we are experiencing. Now, there's also lack of financial stress or support that is also causing anxiety among us. Anxiety and depression, they both go side by side, especially in medical students. It is fueled by the competitive environment. It is fueled by the fear of failure that we have and uncertainty about the future. Now, when I talk about future, I'm not talking about what will happen after 2 years or 4 years. Medical students have anxiety. What will happen in next hour? What's going to happen to us? They have uncertainty about particular hour as well. It's just not limited to years. They don't know what's going to happen to us. Maybe we will, be faced with a surprise test. Maybe we will be faced with a surprise uh, laboratory exam. We don't know about that. So there's a lot of uncertainty present among medical students. The demanding nature of medical education, it exacerbates this condition. It is also prevalent, and it is seen that among 40% of students, they have experiences of anxiety. They are experiencing symptoms of anxiety. All right. Now, the main point is, what's the reason behind these issues? So they are experiencing anxiety not just related to their future, but also they are having exam related anxiety. They are having anxiety that how are they going to face their parents if they do not succeed in their exams? How are they going to deal with those things? All right. Now, the next question is, why is it essential to address mental health issues in medical students? Obviously, it is so much essential that if we are not talking about it, how are we going to build coping strategies? How are we going to change the institutional system that we are having for generations? These things are present since so many years, but Nobody was talking about it. And now suddenly everyone is talking about it. And the reason behind that we are talking about it is because we need to bring a change. We need to build more mental health resources. We need to have more professionals. There are still so many universities here in Pakistan that do not have any counseling services in their institute. They do not believe that it's still important. They think that it might be, a waste of time for the students to actually go to counseling services or to actually talk to a psychologist. Now, alarmingly, there is also a growing concern over suicidal thoughts among medical students. And I believe that is why the main reason behind addressing these mental health issues, because depression or anxiety, it might not be that much alarming, but they are also having suicidal ideations. I will not be lying, and I want to speak about this, that no matter where we stand right now, or how many institutions we are building, or how many medical students we are enrolling in our institutions, we are lacking mental health resources. We are lacking mental health professionals. There's a significant shortage of them, and the services that is even provided to mental health, that's not being taken seriously, which makes it very difficult for the students to seek help because there is no awareness. So I believe that the whole purpose behind addressing these issues is to bring awareness among us. And the stigma that is associated with health issues, that also discourages students from seeking help. And because they are not able to go for therapy, the symptoms that they're experiencing, it basically multiplies in a day. Many students, they do not seek help due to the fear of being judged, or maybe they are perceived as weak. Apparently, we are afraid of being labeled as psycho. That is a term that is commonly being used here. And we are not afraid to basically go take our life, or maybe we are not afraid to take a decision like that. We are afraid to go to therapy, but we are not afraid to make ourselves mentally and physically sick. We are not afraid to starve ourselves. We are not afraid to having sleep deprivation in us. That is also one of the major causes of, they are, most of medical students, they are in the borderline of having sleep disorders or eating disorders. They can go on without eating, they can go on without sleeping, they can go on without having any social interactions, and they are missing on so many social occasions. And that is also causing them lack of self-esteem, that is causing them lack of, confidence in them. But they don't know how to regulate their emotions. They don't know how to share their mental health problems that they are experiencing. And unfortunately, nobody is doing anything about it. We have become expert in hiding or pretending that we are normal and there's nothing wrong with us, and we are unable to recognize that that is the only life we have, and how are we dealing with that, right? Now, last but not the least, I will also like to address that some medical students, they are also turning towards substance abuse. Now, the reason behind is that they are using those um, substance abuse as a coping mechanism. They don't want to experience anxiety. They don't want to experience the fear. So what they do is they try to take maybe nicotine or maybe some illicit drugs that numbs their mind, that numbs their emotions. So they don't want to, experience those things. They are so much afraid to go through all of that. But they are not
Doctor,
afraid.
I would like to ask a few more questions regarding this. I appreciate that you're having such a strong advocate towards mental health for students specifically, that we have gone through a lot. So we can like briefly go through some questions that I have. You have mentioned that a lot of students, as you have listed, have gone through depression, anxiety, and then go to substance abuse. I remember there have been days as a medical student that I have become extremely sad when I've gotten a low mark in an exam that I worked very hard for. So, based on that, what are the signs you briefly see in students who have gone through like moment in their life where it shows that, oh, this child or this student has depression or anxiety? Like, how would you notice this as a professional?
Right. Thank you so much for asking the question. Now, I actually want more questions like that, because the more you will be asking, the more easier it will be to explain the mental health challenges that we are experiencing. Now, talking about the signs and symptoms, unfortunately, they are not obvious symptoms. But if you actually want to, list me down, that there are some symptoms like they are not sleeping properly. Ask them, at what time did you sleep? And they might say, I didn't sleep today. I came to the university without sleeping. Ask them what sort of diet they have, how many meals are they taking per day, or what was the last time that had a proper meal. So they might not be able to remember that. There's persistent sadness in them. There's persistent lack of motivation in them, and there might comes a time in their life that they actually forget what are they doing or why are they doing. Like, I would like to ask the students that I see, that what's the goal behind taking any particular field that they are in. And sometimes when they are not feeling hopeless, when they are not feeling hopeful or motivated, they seem to forget. They go like, I don't know, why did I even choose this field. I forgot what was the reason behind it or what was the motivation behind it. They have forgotten that because they are so much under pressure to win, to succeed, to become the topper, that they actually forget the main core reason behind it. They have lots of interest in activities. They are not on social medias. They are not attending any occasions. They are not coming to birthdays. They like to keep themselves in a room and they have books all around them. Like, you must see a room of a medical student. There will not be any other activities. There will be hardly anything. Only they have books on their left, on their side. Even sometimes they sleep with their books on their laps or maybe on their head, because they don't have time to sleep. They feel like 24 hours is less in a day because they need more time to study. They are not able to concentrate properly. They have difficulty in keeping hygiene. They are not even able to take showers regularly. So I believe these are the symptoms that if you see a friend or a student going in symptoms like this, so there might be a possibility that you have to ask the person, what's going on in your life. Are you feeling okay? Is everything going all right in your life? And sometimes they pretend like, yeah, everything is all right, there's nothing wrong with you. All right. So what was the last meal that you eat? And they have to think about it. I don't remember. It's not important. Why are you asking? Like, they don't keep the basic necessities of their life. They don't give significance to those things. They keep on forgetting about that. So I think these are the common symptoms and signs that you can see in such students. I think that
I
answers the
see.
question.
Yes, that perfectly sums up, as a friend, how to look after another medical student itself, because it would be a very key thing that we have our own peers to help us. So as you have mentioned that there are a lot of factors that causes mental health, specifically in medical student: academic pressure, expectations by self or by others. How do you expect, what are like expectations we should have that we can do to address? You have mentioned that we have our own expectations of selves. How do we counter that? Like, okay, we fail an exam, how do we come about with it?
All right, all right. It's really important to do not associate your self-esteem or your the way or your worth with the grades that you're having. The grades that you're having, they are part of your professional life. Keep that, they are part of your educational life. Keep that limited to that. Who you are, it's not defined by the kind of grades you are having. I know it's easy to say that, but if you have such mindset, you actually stop degrading yourself. You stop demotivating yourself that if I did not get a good grade in that particular exam, I'm never going to have that grade now. I'm never going to, compete again. I'm never going to be part of the uh, the intensity of the level of the exams that we are having. So we don't have to associate ourselves. Try to keep balance when you are dealing with medical exams. And the, these type of thoughts that start coming right before exams, right before final prof, right before you might have to see your supervisor. So you keep on thinking about yourself that, oh, if I don't give a proper answer to my teachers, she might laugh at me. She might think that I'm a failure. She might think that I'm not capable enough to continue in my medical field. So it's important to figure out that what kind of thoughts that we are giving to ourselves, and are they helping us, are they motivating us to actually do something better in the future? Are these thought patterns going to help us in order to face the challenges that we are going to experience further? What we do is, whatever experiences we have in the past, we try to stick to those images. We don't reconstruct our thoughts. Once we have a bad exam, once we have a bad quiz, okay, now we are going to have it all the time. And then there's a term called self-fulfilling prophecy. Whatever we are thinking, somehow we start behaving in a way to actually fulfill the initial thought we have. We are not studying with that intensity as we were before, because now we are demotivated. Now we are not having positive thoughts about it. So it's important that to address those challenges, first you have to identify how are you perceiving your own self. How are you identifying your self-worth? Is it associated with external terms? Because sometimes, like, I know there are some students who are toppers and who have maybe they're studying under the scholarship, so the pressure is too much that we have to complete the exam. But you have to
Yes,
ask yourself,
yes,
we
Dr.
have
Then. There's
yeah.
another question that was added onto that. Like, I understand that sometimes I do. There have been some exams where I have said to a couple of friends that I work better under stress, that I do better in an exam if I pressure myself in the maybe closer when the exam is coming rather than planning it out properly. So, what is your say on how we do as students under high pressure? Especially, like, best example is when the exam date is closer and we're like, oh, I can study last minute, it'll be fine. And apparently, you do. It depends. Some students do well, some students do not. What is your
Yeah.
stand on that?
All right. So stress is healthy for you as long as it's not affecting you negatively. Stress basically motivates you to basically stay focused, to stay motivated and not get distracted. But the moment you feel like now the stress is taking over my motivation, or now the stress is not making me, do something productive, now that stress is not helping you. According to me, I believe that if the stress is at a moderate level and it's helping you out, then all right, you can keep the stress with you because it's helping you out. But the moment you find out that no, now the stress is, it's making me tense, and maybe now I keep on thinking about what if I don't do it? What if this question comes? What if this question will not come? You see, now we are not focused on our goal. Now we are distracted by these thoughts that are fueled by the chronic stress, that is fueled by the negative stress that we are having. It's true that stress does help us. It helps us staying motivated. It helps us to stay focused. But the chronic stress, it also, like at that time, you might be able to, remember things in a better way. You might have a strong cognitive functions going on. But if the stress is chronic, or if the stress has taken over, there's a possibility that right before the exam, you might start having anxiety. And the moment the exam comes in front of you, there's a possibility that you might forget whatever you have remembered before. Why? Because the stress was so much that you kept on focusing on, what if I don't do this, and what if I don't remember this, and what if this question will not come? Then there's a possibility that when the time is right in front of you, when the paper is in front of you, you might forget things. So to summarize it, I will just say, keep the stress moderate level and try to keep the thoughts positive about yourself. If you have a positive thoughts about yourself and you are also having stress about something, then you are motivated and you are good to go. But if you are having negative thoughts about yourself and you also have a stress regarding whatever situation, then there's a possibility that you might experience symptoms of anxiety. You might also have a panic attack, because at that time, you for a prolonged period, you were dealing with the stress, but you were not doing anything about it. You were keeping stress with you. And now the stress has taken over. And so there's a possibility that stress will come out in a physical manner. You might start sweating, you might start trembling, you might start feeling like Now I don't remember anything, and you might having a panic attack. So you have to keep the stress level at the moderate level, I would say.
Yes, doctor. So I have also heard a lot of professionals stepping out and say that they have suffered burnout in their professional field. I have a lot of people have come out, so it's great for our students to know that even professionals admit that they have gone through an episode or have suffered from burnout itself. How do you can you explain briefly what is burnout and how we as students can recognize it easily?
All right. Okay, burnout is something that is extremely common among the students, and it's basically a form of exhaustion that is, experienced because of they are feeling too much, pressure. There's a lot of stress in them, and now comes a point when now they feel like, I don't know how to take a step back. I don't know how to rest. Right? It's a feeling of it's feeling of being swamped due to the pressure, and it happens when we experience too much emotional, we experience too much physical and mental fatigue for a very long period of time. And it's very common among students, and it's also common among professionals. Right now, you also asked me about the symptoms, right? If you are feeling tired or if you're feeling exhausted, and you feel like now there's very less enthusiasm, there's very less motivation, there's very less excitement towards the goal, right? So they are feeling tired, they are very less motivated towards their goal, and now, like I mentioned before, now they're confused about why did I go for this field, right? They are feeling drained. They are unable to emotionally deal with the problems that they are, experiencing. And they are feeling low. They don't want to talk to their friends. They don't want to hang out with their friends. They just want to stay quiet. They don't feel like they have energy in them to basically deal with these things. They are, doubting themselves. They are, feeling that maybe we're not able to compete with other students. There's a lot of comparison going on between you and the other students, and you might feel like, maybe this person can do better than me, and why should I, try to put myself in the same situation? Like, I'm done with the stress, I'm done with the fatigue, I don't want to do it anymore. Something like that, right? There's also physical symptoms as well, that you feel like you have a body ache, or you feel like there's a lot of pressure in the stomach, you have lost the appetite. So I think that's about it.
So do you want to add anything more to the overall questions that we had before we go into the Q&A session with the audience?
All right, I would like to say one last thing. So there's a lot of need for mental health support systems, and it's very crucial to improve mental well-being of students in our country, or maybe if we talk about globally as well. So I just want that whatever discussion that we are having and whatever the kind of discussion that we're doing, I just want to leave a positive impact to all of the students. And as you can see, we have 100 students here. So if we, go back to our homes, we go back to our places, and we discuss that these are the challenges we have heard, and these are the strategies that we have discussed. Like, I want all of you to basically talk about this thing, talk about this to your friends, talk about this to your parents, to your colleagues, try to spread awareness as much as you can.
Okay, thank you so much for all that information, doctor, and the fact that you're advocating for mental health and the resources for it. So we'll go now to the Q&A session by the audience and by also the forms that were filled before on the social media. Thank you so much, doctor.
Hello, everyone, yet again. First of all, I would like to take a moment yet again to thank our beloved Dr. Afra for being with us and sharing those wonderful insights. So now the podium is yet again open to the audience. Luckily, we have around 104 people. So hopefully people, either you can raise your questions in the chat box and I can read them out. Otherwise, you can feel free to raise your hands and ask the questions directly to the doctor. Yes, we have one question. Yes, Shaina, can you please share your thoughts or doubts?
So hello, hi doctor. What I wanted to ask is like as someone that has like as someone that grew up actually being academically smart, or like someone that's been very big on academic achievements throughout high school and throughout our academic careers itself. And then when you come to med school, there is this you have this tendency to over compete I don't know if I'm putting it right, because so like in my opinion, I have this tendency to overcompete and kind of like burn out myself very unnecessarily, and also it's like it takes like a massive hit on my self-esteem itself if I'm unable to achieve the best, like unable to achieve what I expected, whether it is the best or not. And even if it's by like a very slight difference, it takes like a very massive hit on my self-esteem and how I view myself at all. So would you be able to tell me like how I could actually fix this? Because I feel like it's something that's very unhealthy for me as of yet, because it's just burdening me pretty unnecessarily. Like personally speaking, I would really value any insights you to give me on that.
Right. Thank you, Shaina, for asking that question. First of all, I'm sorry that you are experiencing burnout on such an intense level. I can completely understand what you're going through, and you have to understand that burnout builds over time. It's never built in a day or so. So you have to figure out that what am I doing for the past period of my time? How am I dealing with things? What sort of stress am I experiencing, and how am I coping with that stress? How am I making my life difficult? I know medical education itself is extremely intense, and it has a lot of pressure. And how am I doing? What am I doing to make it better? Am I making it better, or am I making more disturbing, more difficult for me? First you have to identify that. And I would also suggest you that you must talk to your supervisor wherever you are. Try to talk to her that these are the symptoms that I'm experiencing and I'm not able to manage my workload. So how should I go about it? Because I believe that communication is very important when it comes to dealing with burnout, when it comes to dealing with toxic environment, or like in order to have a healthy environment, it's important that you communicate your feelings. If you can talk to your supervisor, do that. And if you're not able to do that, I would suggest you to start writing down your feelings, because I know the intensity and the criticality of the medication itself is too much. Medical field, it's too much. We cannot do anything about it to lower that down. What we can do is we can try to come up with little coping strategies to deal with it. So communication is one of that thing. Secondly, I would suggest you to have a schedule and make sure that you are having enough sleep and you are working on your diet. Because when we are in this field, and like I said before, that we are not taking care of our basic necessities, we're not taking care of our hygiene. So sleep is very important for your physical and mental health. So try to have a good sleep and try to have a proper diet. Secondly, you can also be mindful about your things, that whenever you are in the classroom or whenever you are in your college, try to see what's going on around you and how are you feeling in that moment. Because mindfulness, it helps you to identify when you're feeling overwhelmed and when you are taking stock of your emotional well-being. It helps you to manage the challenges of your life and your study and maybe future in the professional life as well. Try to talk to your supervisor, try to talk to your friends, your family, because their support can also deal with these stresses. And I don't know if you have a counselor in your university. If you have, try to go to her, because she might help you with some yoga exercises, some meditation techniques that will also help to release stress in your body. The symptoms of burnout, it might appear physically as you can hold on to stress in your body. So meditation will definitely help you to release the tension. I hope that answers your question, China.
Thank you so much, sorry, doctor. But what I mainly wanted to know is if there is anything specific that I could do to like tackle over competitive nature that I have, is what I actually wanted to know, to be honest. But
Okay.
your insights did enlighten me a lot. Thank you so much either way.
Thank you, China.
Thank you very much, Doctor, for that wonderful answer. There are a couple more questions that are in the chat box. I would like to read it to you. A person said, as a first year medical student who are going to start their MBBS journey, what are the challenges they will face, and like, can you share your insights on how to deal with them?
All right. I think someone with a medical background or someone who has done MBBS can answer your question better, because I haven't done my MBBS. I'm doing my PhD. So it might be a different, but what I can tell you is that initially in whatever field that you are going with it, you will have a lot of comparison among your students. You will want to be everyone's favorite. You would want to come up in the teacher's favorite book list. So I would suggest you to keep those expectations lower. Keep them realistic and try to make sure that whatever goals you are having, they're achievable. And when are they achievable? What is the time period that you are attaching with it? What I'm talking about is these are smart goals, that they are uh, measurable, they are sustainable, they are achievable, they are realistic, and they are timely oriented. So I think that would help you.
Thank you very much. I think that summarizes the question. Another fellow student asked, how can we talk about these issues? For example, when it comes in interviews, because I know in residency they don't like depression and burnout topics. So, like,
All
doctor,
right.
how
So
would you go about this topic?
yeah, okay. So that completely depends about the policies of the companies that you're going about, and how you can tackle with these questions, that instead of, expressing yourself out, instead of telling everything about yourself, I would suggest you to ask them that what are their policies regarding psychological issues. How do they cope up if any of your employees have a symptoms of depression? What are your strategies, or what do you have, what your company follows, what are the structural rules are you guys following? So I would suggest you that before telling them that you might have such symptoms, I would suggest you to first ask them that what are their policies, how are they dealing with if any of the employees have such symptoms. I think that would answer the question. If they tell you that we don't do anything about it, so you would know that this might not be the right place for me to talk about it. And if they tell you that we do have strategies, or we do have counselors, so then maybe you might start opening up, not in the interview I would suggest, but once you get hired, then you might talk about these things. I think
Thank you
that
very
would
much.
answer the.
Thank you very much yet again, doctor. We have, I think, two more questions. The next question is uh, being asked is that could you please talk more about the importance of being a patient with yourself? How do you look after yourself first when it
Right.
comes to these matters, even though you preach and you guide others? Because
Right.
that's a
Okay.
common issue.
That's actually a very good question, and it's something that we as a therapist, even we follow those things as well. We have to be patient ourselves by first of all, stop associating your self-worth and your self-need with any external factors. Who you are does not depend on your achievements or whatever you have surroundings. Try to keep self-worth to a level that is, firm, that is not easy to break. Secondly, what you can do when you talk about being patient to yourself is stop punishing yourself for any external situation, that whatever we have. Sometimes when I'm having a session, and when I'm giving counseling session, therapy, when I'm providing, sometimes my client is not able to understand what I'm saying. So I try to give definition of things, or I try to explain in a way that the other person might understand. And even then, still, if he's not able to understand, then I don't punish myself for that. I think maybe the other person has not the capability to actually understand what I'm saying. So I try to focus on the reasons that why are they not able to understand. So likewise, you have to try to see the main reasons behind things. Whatever situation that you are in, try to figure out why is this happening, instead of saying that why is this happening to me. It's not about you, it's more about what's the situation that is happening.
Right now, I would like to deeply thank our licensed clinical psychologist, Dr. Afra, for answering a lot of interesting topics and a lot of interesting questions. Thank you very
Thank you
much,
so much.
doctor. I would like to move on.